Hello students, continuation with the DOTS treatment regimen. This box you have to keep by heart, that is daily dose schedule for adults on based on the weight bands. So in adult category the weight band is 4 bands, weight bands are there. Accordingly the medicines are being supplied. There is intensive phase and continuation phase, and compulsory injection for initial 8 days, initial 8 Sundays. So that is being provided for the patients. Single combination of HRZD in single tablet. Following doses are being provided, and the dosing will remain same even if the weight band changes during the entire course of TB treatment. So once the patient start with first band, then after 2 months, if the patient weight increase come to second band also, there will not be change in the drug category. The patient has to be on the previous first band itself. And this content of the drug box is there is a different colors are there. So usually red is the common color that is used for first weight band, that is new cases. So in that you can see the tablets, 1 month 28 tablets are there in one strip. So in this red box they will be keeping the medicines, and that is being supplied for the patient. So this is single versus FDC blister pack. So first picture shows a single dose blister pack. So you can see total of 4, 5, 6, 7 tablets are there, and that is being taken in a weekly basis, in the intermittent basis, thrice in a week, thrice in a week, twice in a week. In that way it is being taken, and which one has to take first. In that way the scheme is being provided for the single blister pack. Now presently we are in a new regimen, that is fixed dose combination. So in that there is no issues in understanding. If any single person, layman, can understand the medicine dosage, that is every day the person has to take one tablet. So all total of 20 tablets are there in one strip. So this is entire aspect how the patient has to be taking this tablet in this new regimen. The category is here. There is only 2 categories we have. New, that is category 1, that is first one. New, newly diagnosed cases, that is category 1. Second one is previously treated cases and coming with relapse or some, or with any other issue, or with drug resistant. If the patient is coming, the patient comes in a category 2. In category 1, when there is intensive phase and continuation phase, HRZD combination tablet has to be taken according to the weight band for a period of 2 months. So 2 is written in front, that means it constitutes month. 2 months the patient has to be on intensive phase, followed by the patient has to be on a continuation phase for 4 months. So total 6 months the patient has to be on a regular medication intake in category 1. Category 2, first 2 months patient has to be with HRZES, streptomycin. Then followed by 1 month patient has to be on HRZD, streptomycin no need. Followed by the patient has to be on a continuation phase, that is for 5 months, that is HRE. So total the patient has to be on 8 months of medication treatment for category 2. Okay, so this table also you have to keep by heart. In little more in detail about category 1, for a new TB cases the treatment will be for 6 months, that is 24 weeks. Intensive phase will consist of 8 weeks of HRZD in daily fixed combination according to the weight band. Intensive phase 2 months, continuation phase for 4 months, that is 8 weeks plus 16 weeks. So it is just an explanation about the table. There will be no need of extension of intensive phase. Only pyrazinamide will be stopped in continuation phase, while rest of the three drugs will be continued for another 16 weeks as daily dosages. Continuation phases can be extended by 3 to 6 months in certain forms of TB like CNS TB, skeletal TB, disseminated TB based on the clinical decision of treating the physician. So only in these cases the continuation phase is extended for 3 to 6 months. Next, coming to category 2. So that is previously treated cases. So here the medicine treatment is for 8 months. Intensive phase consists of injection streptomycin and HRZD in daily dosage as per the weight band. Injection streptomycin will be stopped after 8 weeks and remaining 4 drugs will be continued for the another 4 weeks. There will not be any extension of intensive phase. At the start of continuation phase, pyrazinamide will be stopped while rest HRE is continued for another 20 weeks. Continuation phase here also it is extended if any of these cases are being seen. So this is just a nutshell about total how many doses patient is being on. That is in category 1 total of 56 doses patient is taking, that is 28 into 2. 2 months the patient has to be on regular medicine, then total 56 doses. Continuation phases the patient has to be on 4 months of the medications, that is 28 into 4, so total of 112 doses. In category 2 the patient is on medications for 3 months and it is 84 doses. In week basis also the calculation is being given, and followed by the continuation phase for 5 months, and that is 180 140 doses. So in weekly basis it is being calculated. So this is a little bit more about doubts. There are few more slides that we'll see in the coming classes. Thank you.